Have you ever felt a tightening in your chest or nervousness? From the outside, things seem normal, but anxiety and phobia are more fearful disease than external injuries. Anxiety and phobia. Now you can put your mind at the rest with Oriental medicine. As the world becomes more modernized, human lives have become unstable and extremely stressful. And under these conditions, people tend to feel mentally confused and disturbed. And when the symptoms worsen, it becomes anxiety and phobia. So today in Oriental Medical Digest, let's find out the symptom and the prevention for anxiety and phobia.
아침에 일어나시면 몸이 개운하지가 못하시죠?
The most fundamental cause of anxiety phobia is excessive stress. Anybody can have a little bit more of the symptom of anxiety phobia, but if the symptom becomes severe, you need medical help. In Oriental medicine, we regard anxiety and phobia as diseases that are due to weakening of heart and liver. So Dr. Cho, what are the common symptoms for anxiety phobia?
불안공포라고 그러면은 이 일반인들도
Most normal people have had some experience with anxiety and phobia.
심하게 두근거리는 이런 증상을 제일 많이
The most common symptoms are excessive palpitations and getting startled easily.
열기 자체가 명치에서부터 얼굴 쪽으로 확 달아오르는
Also,
상기감.
the face gets hot and red due to heat.
심하면은 가슴이 아픈 흉통.
The disease is also accompanied by headaches and heartburn.
아프게 됩니다.
Oriental medicine diagnoses anxiety and phobia with a variety of methods. Among them is reading the pulse. This helps the physician evaluate the patient's condition through determination of patient's constitution and pulse rate. Together with pulse reading, the diagnosis of anxiety phobia involves measuring blood pressure. The measurement of blood pressure plays an important role in evaluation heart function and patient's psychological condition. If the blood pressure is too high or too low, anxiety and phobia can worsen. Also, the doctor should observe the patient carefully to discover their symptom through patient's facial expression. Another method for accurate diagnosis for anxiety and phobia would be the abdominal examination. The abdominal examination plays an important role in learning more about the patient's 5 organs and 6 entrails, such as the kidney and intestines. The patient will feel the pain at the spot where the problem organ is located when the physician touches the spot with his fingertips. To this, we add another method for more accurate diagnosis. The pain diagnosis machine. This machine lets the physician hold it with the handle and make very small current flow through the patient. As the current passes through, the patient will feel pain in a particular spot, and the spot will make sounds. This machine is used to treatment, discover the location and level of the pain. In the same way, the pain diagnosis machine is used on the ear. The ear's organ where all the nerve coverage, and applying the machine to the ear will help to find the painful weak area of the body. You can see the lever going up when the current is passing through a painful area. So many different methods are used to diagnose the exact condition of the patient before prescription.
직장 다니신 지 얼마큼 되셨어요?
Anxiety and phobia are diseases related to human mind, so the doctor has to have a good grip on the mental state of the patient. He has to be able to listen carefully and to what the patient is saying and observe carefully in patient's surroundings, such as family, friends, and colleagues. The most basic training at this point would be the mutual trust between the patient and doctor.
말씀 많이 안 들으세요?
In this way, the doctor should be able to put the patient mind at the ease and resolve the patient's anxiety and natural way through the conversation. So, doctor, what condition is she in right now?
얼굴이 화끈 달아오르는.
This patient is a working woman. With the worsening of the economy, she lives in fear and terror of being laid off. Her face gets heated up, she has insomnia and headaches, and complains of a tightening in the chest. Physical symptoms include a weakened heart and a lot of heat, particularly in the area of the heart. She can expect full recovery after 1 to 2 months of medicinal therapy and aromatherapy.
There are more and more people every day suffer from anxiety and phobia. First treatment for anxiety and phobia is consultation with the physician to find out the symptom and the condition of the patient. And follow-up with medicinal therapy is necessary. So let's find out more about the medicinal therapy for anxiety and phobia. Medicinal therapy make use of 총명환, which enhance the function of the heart and liver. Yonggol is a herb that used to stabilize the anxious and nervous mind. 백복신 is also used to stabilize the mind as it strengthens the weakened heart. Sanjoin is good herb for relieving the sleeping disorder due to anxiety and phobia. 석창포 is good for clearing the head by activating the brain cells and enhance the function of the brain. It is also good for headaches. Wanji is herb for mental illness, relieves depression and nervousness that appears due to anxiety and phobia.
This is a form of treatment using aroma. The inhaled aroma will stimulate the cerebrum, eliminating fear and nervousness and stabilizing the mind. About 15 minutes a day would be adequate.
So how do you feel? Do you feel any different?
향을 맡아보니까요, 향이 아주 좋고 이 기분이 상쾌한 것 같아요. 그리고 뭐 잠깐 이렇게 하다 보니까는 머리도 맑아지는 것 같고 머리 아픈 게 조금 낫다고나 할까 그런 기분이 드네요.
예, 불안공포 예방하려면요, 우선 첫째 마음을
For the prevention of anxiety and phobia, trying to stay in a comfortable and composed frame of mind is a must.
그 환자분의 어떤 그 체력 또
It is also very important to have sufficient exercise and to stay active by settling into a suitable hobby.
취미 생활을 하시는 게 좋겠습니다.
Anxiety and phobia are difficult to combat alone. Of course, the patient has to make effort to become more extrovert. But what is more important is comfort and warmth from the surroundings. As the family has closer relationship with the patient than anybody else, the patient needs constant love and care from the family. It will be particularly helpful, the treatment if the patient can find a hobby or he or she can enjoy with the family. Anxiety and phobia, illness that can overcome only if the patient and doctor and family all pull their effort together. You'll make it if you face this problem with your family. To have healthy mind, first you need to understand yourself and understand the action and accept the situation comfortably and wisely. Just remember, healthy mind makes healthy body. Thanks for joining us today and see you again next time.